For most of us, scheduling a dentist appointment happens when a dull ache turns into undeniable pain. We wait until the enamel gives way. By the time you actually feel that discomfort, a tiny, easily treatable cavity has already breached the deeper layers of the tooth. What could have been a quick, simple fix now requires invasive, restorative surgery to correct. Avoiding the chair out of anxiety doesn't protect you from pain. It actively sets you up for a recurring cycle of severe dental distress. The consequences of that decay don't stop at your jawline. The mouth operates as a mirror of your systemic wellness, directly reflecting the health of your entire body. In this circulatory diagram, bacteria from oral decay breach gum tissue and enter the bloodstream, triggering inflammation that elevates cardiovascular risk. This unchecked inflammation hinders diabetes management, creating a vicious cycle. High blood sugar worsens gum disease, and gum disease spikes blood sugar. To break these cycles, clinical networks like the Khuwair facility, accessible through medreachgulf.com, replace the reactive model with a technical framework designed to catch these issues early. Modern dentistry serves as a diagnostic checkpoint. By using precision technology, practitioners identify risks to your systemic health before they require more serious medical intervention. This proactive strategy relies heavily on specialized equipment. Low-radiation digital radiography, for instance, generates instant, high-resolution images that expose microscopic cracks long before they cause you any physical discomfort. Behind the scenes, these clinics adhere to strict international sterilization standards. By running tools through advanced autoclaves, devices that use highly pressurized steam to eradicate bacteria, they ensure absolute biological safety during every visit. That same safety and precision extends to complex restorative work. Historically, treatments like custom dental veneers or durable implants carried a heavy stigma of intense pain and long recoveries. Today, modern sedation techniques and highly targeted local anesthesia have neutralized that fear. Patients report feeling absolutely nothing, as the targeted area is completely numbed before the tools are even picked up. Technology has turned complex cosmetic dentistry from a dreaded ordeal into a predictable process, where you simply sit back and let the tools do the work. Of course, preventative care and precise technology can't stop a sudden physical accident. This triage chart outlines the exact protocol if you get a tooth knocked out. You must pick it up strictly by the crown, never the root, and immediately submerge it in milk or saliva to keep the biological cells alive. If you are dealing with a severe toothache, rinse your mouth with warm salt water and carefully floss around the area to dislodge any trapped debris that might be aggravating the nerve. And pay attention to this warning. Do not, under any circumstances, crush aspirin and apply it directly to your gum tissue, as it will cause severe chemical burns. For a chipped tooth, gather the broken fragments, rinse your mouth, and hold a cold compress against your cheek to restrict blood flow and stop external swelling. During sudden dental trauma, executing this step-by-step triage protocol correctly will largely dictate whether that tooth survives before you ever reach the clinic doors. Even with all this clinical technology at your disposal, the long-term integrity of your teeth comes down to the habits you maintain in your own bathroom. That means brushing twice a day with fluoride for a full 2 minutes. You also need consistent water intake to maintain a healthy saliva balance, which naturally washes away acidic buildup. This area map of a standard molar illustrates the math behind flossing. Exactly 40% of your tube's surface area is completely hidden between the teeth, making it physically impossible for standard bristles to reach the plaque accumulating there. These daily routines form the essential biological baseline that allows high-tech clinical treatments to succeed permanently. Between digital diagnostics, precision equipment, and proven emergency protocols, clinicians have removed much of the friction from both aesthetic procedures and sudden trauma. You don't have to compromise when it comes to your systemic health. To access top-tier dental services in Khuwair or Seeb, visit medreachgulf.com. Their team operates with rapid WhatsApp accessibility, averaging a response time of under 5 minutes, so you can secure a consultation immediately. Selecting a clinic that utilizes these modern tools allows you to maintain the oral health foundation necessary for your broader physical well-being.